going to be looking at the topic of psychopathology and the unit of definitions of abnormality, AQA AS Psychology. Definitions of abnormality. The first one is statistical deviation. This is when certain behaviors or characteristics are normal and anything that deviates from this is considered to be abnormal. For example, IQ. Having an extremely low or even a high IQ will be considered to be abnormal, and so they expect our IQ to be somewhere in the middle. Evaluating this definition. This definition has real-life applications because it allows a diagnosis of intellectual disability disorder in terms of classifying normal and abnormal behavior characteristics, increasing its in clinical assessments. However, a weakness is that having unusual characteristics is not always seen as negative. For example, having a high IQ is not undesirable. This emphasizes how unrealistic the definition is and that it cannot be used alone to make a diagnosis. Another weakness is that labeling those who are unusual impacts their mental health because it can lower their self-esteem and cause them distress. In fact, there should be sense of encouragement shown. For example, telling them that being like this can't really reduce your chances of success in life. Another definition of abnormality is deviation from social norms, and this is when you behave in a way that is not expected, and this is considered to be abnormal because it's not the social norm. Social norms can be specific to culture. An example is antisocial personality disorder, and this is basically when you're extremely angry, selfish, aggressive, and irresponsible, impulsive, and you fail to conform to sort of ethical behavior. Evaluating this definition. A strength is that it includes desirability of behavior, unlike statistical deviation, which increases its external validity. And another strength is that it has real-life applications because this definition enables the diagnosis of antisocial personality disorder in terms of classifying normal and abnormal behavior characteristics, increasing its usefulness in clinical assessments. However, a weakness is that it's prone to individual differences because some may not consider certain behaviors to be abnormal and others will do. This once again questions validity. Another weakness is that relying too much on this definition can result in systematic abuse of human rights because some diagnoses are there to maintain authority over others. For example, nymphomania was seen in women, and a symptom is that they had a sexual attraction towards the working class men, so it's basically the general population. This means that anyone who was different from this would be abused, which is obviously unethical. Another definition of abnormality is failure to function adequately, and this is when you cross the line between normal and abnormal behavior or the way you act or maybe in a situation, and you reach a point where coping with the demands of daily life is impossible. The signs that someone is not coping, according to Rosenhan and Seligman in 1989, were that they don't conform to standard interpersonal rules, for example, maintaining eye contact and respecting personal space. They experience high levels of personal distress. Their behavior can be dangerous to themselves or others and is irrational. Evaluating this definition. A strength is that the patient's perspective is taken into account because subjective experience of the individual is included, increasing external validity. Nevertheless, it is difficult to identify when someone is failing to function adequately and when they are deviating from social norms. For example, not having a job is failure to function adequately, but people may want different lifestyles. This limits freedom and discriminates against minority groups, and once again questions external validity. Another weakness is when you judge. Is how to judge when someone is failing to function adequately. You have to judge if they are distressed, and everyone interprets distress differently. Or you may feel that someone is distressed but is not suffering. Nobody has the right to make this judgment about you. Another definition is deviation from ideal mental health. So what makes you normal? Once you find this out, you can obviously figure out who differs from this. What does ideal mental health look like? And Jehoda in 1958 created a criteria to judge what ideal mental health looks like. So, you don't show distress, you self-actualize, which means that you reach your potential, you have a realistic view of the world, you can cope with stress, you're rational and see yourself accurately, you're independent, you have a good self-esteem and lack guilt, you can work, love and enjoy in life. Evaluating this definition, a strength is that it is comprehensive because there is a broad criteria for mental health, which covers why help may be required for mental health services if you're not ticking off the criteria, which increases its validity of the criteria. However, a weakness is that Jehoda's criteria is culturally bound because collectivist cultures would see achievement and self-actualization as being self-indulgent and giving ourselves more importance than family or community. But this would not be the case with individualistic cultures. These differences have not been accounted for, which decreases the representativeness and generalizability of the definition. Another weakness is that Jehoda's criteria set unrealistically high standards when it comes to mental health because nobody can achieve all of the criteria at one point in time. So this would see all of us as abnormal, which is not the case, which once again, really makes us question its external validity. In our next video, we will look at phobias, but before then, make sure you make your notes on what we've covered so far. Remember to revise, rest, test and repeat to yourself. Don't forget to follow us on Instagram. Thank you to Canva because I made these slides using their templates. Don't forget to like, subscribe, comment, press the bell icon on our channel, Revision Hub. Thank you so much.